Thank you, Dr. Akshay. Good morning, everybody. It's a beautiful Sunday morning, and thank you, the organizers, for this opportunity to speak here. So I'm presenting a very small, short abstract, phase 2 study presented in the European Lung Cancer Congress. It's a phase 2 study of Unecritinib monotherapy in first-line treatment of ROS1 positive NSCLC. So this was presented by Shun Lu, and the introduction and study design. At present, crizotinib and entrectinib are the standard first-line treatments for ROS positive advanced NSCLC with an overall response rate of 71.7% and 67.1% respectively, with a median PFS of 15.9 months and 15.7 months respectively. The newer drug, that is Unecritinib, is a novel compound which deacylated metabolite targets to receptor tyrosine kinases including ALK, ROS and MET. As reported in ASCO 19, previous study, that is the phase 1 study, showed twice daily dosing, a clinically good efficacy and tolerable side effects in ALK, ROS and MET positive patients who failed the standard therapy. So the key eligibility criteria for this study were patients should be more than 18 years of age, ECOG PS 0 and 1, locally advanced or metastatic NSCLC, and received no more than 2 chemotherapy regimens and ROS positive. They were given the newer drug 300 milligram twice daily until disease progression and intolerable toxicity, with a primary endpoint being overall response rate and secondary endpoints being disease control rate, duration of response, PFS and OS, and safety. The demographics were quite evenly spread. The median age was 52. Approximately equal numbers of males and females were included in the study. Never smokers, ever smokers and current smokers were also included in the study. The primary pathology was adenocarcinoma as understood, and the stage 3 about 8 patients and stage 4 about 103 patients were there. Brain metastases were also included. About 33 patients had brain metastasis, and previous chemotherapies 0, 1 and 2 were evenly spread, with first line patients being approximately 65, that is 58.6%. Now a very important slide, efficacy of overall response rate and DCR by IRC. So if you can see here a beautiful waterfall plot, the overall response rate of the new molecule, that is Unecritinib, was about 78.4%. The DCR percentage was 87.4%, and the median DOR was 20.3 months. So if you can see the forest plot, it was quite favoring the newer medicine in the first line treatment of ROS. The only outliers were patients being more than 65 years of age, those who were smokers, and when it was used in later lines of therapy. Rest of all the parameters showed a benefit towards Unecritinib with the statistically significant confidence intervals. If you can see the Kaplan-Meier curves, the PFS and the overall survival probability was quite acceptable. The safety profile, we can see that transaminitis was the primary concern, with approximately 3 to 7% of the patients having raised AST and ALT. There was also incidences of neutrophil count decrease, that was febrile neutropenia. Rest of the the side effects were well tolerated. There was one important side effect, that was ocular organ diseases of any grade were seen in approximately 26% of patients. So concluding, for the first line treatment of ROS1 positive locally advanced or metastatic NSCLC patients, Unecritinib showed a promising efficacy with manageable safety profile, offering a new first line therapeutic strategy with an overall response rate of 78%, a DCR of 87.4%, a median PFS of 15.6 months, and a median duration of response of 20 months. The 12 and 24 month OS rates were 98% and 88% respectively, with more than grade 3 adverse events being 45%, treatment related severe adverse events being 3.6%. Safety of ocular organ was good. So with this, I'll conclude the presentation. Thank you.